Hello, my name is Karen and I'm here to have the Tixel treatment. It will be my first time having Tixel, and I was really looking to have something done because I have scarring from acne as a child, chicken pox as an adult. I've got some fine lines and wrinkles, crow's feet, some bagging under the eyes, and the neck. Reached the age where the neck needs a bit of firming up, and it's really, I need resurfacing of the skin because there's a lot of irregularities that I've always had, large pores as well.
Tixel is a very exciting treatment. It's a novel treatment based on thermomechanical ablation. It's effectively a fractional treatment that's applied to the skin surface. It's using heat. It involves a small plate that has a little pointed aspect to the plate, like little mini pyramids on the plate. And this plate is heated to 400 degrees C. But it literally touches the surface of the skin for just a number of milliseconds. So not even a second, but a millisecond. And it's just enough to cause a thermal effect on the surface of the skin. And we can use this thermomechanical ablation, this fractional treatment, in a variety of different ways. We can leave the plate on the skin for a fraction longer, and that gives us a more ablative setting, which means that there's going to be a little bit more surface damage from that heat, but that creates quite a significant healing response to remodel and regenerate the skin. And that's called an ablative setting. The results of Tixel ablative settings are very similar to a fractional CO2 laser resurfacing, which for some time has been the gold standard of skin resurfacing. However, the advantage of Tixel over the laser CO2 is that it is significantly more comfortable for the patient. A laser CO2 resurfacing is extremely painful. Often patients really do not tolerate the discomfort from it at all. And in certain situations, they may need to have it done under sedation or even anesthesia. However, with Tixel, just a light covering of local anesthetic cream, and patients feel very little other than a very transient heat or warmth as the little plate touches the skin. This allows us to do a treatment over the whole face or pretty much anywhere on the body if we want, but very simply a treatment with minimal discomfort and very well tolerated. In the ablative setting, where we get results and a remodeling of the skin, which can take several months, then there is very little downtime as well compared to a CO2 laser. We know a CO2 laser really causes a lot of damage not only to the surface of the skin but often to a deeper extent, and that takes a long time to heal. So patients are usually very red and very swollen and in a lot of discomfort for up to a week after a CO2 laser, and that redness, it can last sometimes weeks and months before they've made a full recovery. Whereas with Tixel, even on the ablative settings, then the downtime can just be a few days. So there may be a number of hours of quite significant redness, but it does settle very quickly. And usually by the following day, there is perhaps just some very slight redness. There are some very tiny little micro crusts on the surface of the skin, which can easily be covered by adequate moisturization of the skin. So I find that most patients can return to pretty normal activities or work within 1 to 2 days of quite a significant ablative fractional treatment with Tixel. There may be very, very tiny little crusts on the surface of the skin, and those will all go over the next few days. So with the ablative setting, one can put makeup on 72 hours later and cover over any redness or pinkness, but in my experience most people are pretty much back to normal after 4 or 5 days. The other advantage of this thermomechanical treatment called Tixel is that we can use a much lower setting, and by that we mean that the plate, it's still heated to 400 degrees C, but it touches the skin for even less time. And in this situation, we get less of a thermal effect, i.e. less damage to the surface of the skin. But that thermal effect at the lower times can actually create a porosity of the skin. It creates little micropores or micro channels. And this allows us to put products or treatments onto the surface of the skin that we know will penetrate the skin and penetrate them as effectively as if they'd been injected with needles. The advantage, however, over injecting with needles is that we cover a much larger surface area. So there are many more of these microchannels or pores than we could ever create with a needle. So we get a much far superior absorption of any product or treatment that we put onto the surface of the skin when we're doing it this way. The other exciting thing is that the pores, or these microchannels that are created from Mezotix, or as we call it, it's called a Mezotix, they will last up to 6 hours. So it gives us a long window to put something on the skin for it to be absorbed. Now we know that if we needle the skin and we put a product on the surface, it can get absorbed, but needling the skin only allows a matter of minutes before those little microchannels that have been created by a needle seal up. That's very different to Mezotix or Tixel, which leaves a channel open for up to 6 hours. And really there are no other treatments that can give us that effect. Also, the microchannels and micropores are of a significant size, up to 100 microns in diameter, which means that we can actually put on the surface of the skin not only things like hyaluronic acid or mesotherapy treatments, amino acids, proteins. We can actually put on the surface platelet cells or even adipose-derived stem cells, which will pass through that little microchannel and have quite a significant effect, a regenerative effect on the healing.
The aftercare will be very, very gentle cleansing, and then I have been given some skin rehydration serum, and that is to be put on 4 or 5 times a day. And even though the box says a couple of days, because I've had treatment, it would be 4 or 5 times a day, and just keeping the skin very hydrated.
We can also use more sophisticated medicines and chemicals on the surface of the skin if we want to have specific actions, and we can now start to treat melasma, which is a deep pigmentation in the skin, which it can be very difficult to treat even with laser therapy. We can now use certain agents on the surface of the skin which can pass through and reduce significant deep pigmentation. So it's a very, very exciting treatment. It's a novel new treatment, and I think one that has a lot of scope, a lot of indications, very well tolerated by patients, very little downtime, and I think that's what's going to make this thermomechanical ablation known as Tixel a very, very popular and in-demand treatment.
I believe it went very, very well. It wasn't too uncomfortable. The skin does feel hot and the eyes slightly puffy, but all very, very bearable. And very excited to see what the results will be in a couple of weeks' time.